So good morning. Thank you for joining One Neighborhood Builders for our monthly Fresh Friday series. I'm uh, I'm Allie Steinberg from One Neighborhood Builders. If you'd like to turn on captions for this discussion, you can do so. First, click captions on the bottom of your screen. And if you don't see captions, you can click the three little dots icon on the bottom of your screen and click captions. And then choose your caption language and click show captions. Grace, would you mind changing to the caption instructions on our screen here?
How's that?
Perfect. Thank you. So here they are on your screen, and Grace is going to put some instructions in the chat on how to turn on those captions. And so we're so grateful that you all are here this morning. So we launched this Fresh Friday series to create space for practitioners, community members, policymakers, and other interested people to learn and share about community development, especially topics that are deeply important to community development, which includes how to maintain and improve the quality of existing housing, especially affordable housing. We launched this, and so before we get started, just a few quick notes on logistics for the day. First, please note we will be recording the session as we intend to share it with interested individuals who are not able to join us this morning. Second, if you have questions or comments while one of our panelists is speaking, please feel free to leave it in the chat and we will try to incorporate it into the session. Towards the end of the session, we will be taking questions from the audience, including questions you all submitted in advance. And so if you have questions, get them ready. And third, we want to remind you that if you hear a phrase or an acronym you aren't familiar with, we encourage you to ask about it in the chat. My colleague Grace Evans-Pettigrew will be watching the chat and will jump in to explain as she's able. This is a space for learning and we encourage you to use it as such. And fourth, please take a moment to introduce yourself in the chat. So today we're going to hear from some incredible panelists who have advanced, developed, and studied home repair programs in Rhode Island and across the country. Karen Black is the principal of May 8 Consulting, Inc., and also works with the University of Pennsylvania, Drexel University, and the Lindy Institute for Urban Innovation. Karen is a former housing lawyer who worked in fair housing issues and has worked in various housing organizations and has developed and researched home repair programs. Karen also advises communities on coordinating home repair programs. Bert Cooper is the Vice President for State and Local Strategic Services for Green and Healthy Homes Initiative. Bert is based here in Providence, but his work spans cities and states. GHHI's mission is to address the social determinants of health and racial equity through healthy housing. GHHI has implemented home repair programs in several states and cities, including in Baltimore, Maryland, Philadelphia, Pennsylvania, Providence, Rhode Island, and Trenton, New Jersey. And Carrie Zaslow is the Executive Director of the Providence Revolving Fund, or PRF. PRF is a community development financial institution, or a CDFI, that focuses on distributing funds for home repair, small businesses, real estate development, and historic preservation. PRF has recently developed collaborations with the City of Providence Department of Inspections and Standards, which manages code enforcement for minimum health and safety standards, and the state of Rhode Island to provide home repair loans to lower income Rhode Islanders whose homes have code violations. So now we're going to hear from our panel. So Karen, I want to start with you. There's been a lot of discussion in Rhode Island and in other places about housing crises. So can you talk about what are home repair programs, why are they needed, and how do these programs relate to the broader housing crisis being faced in Rhode Island and also across the country right now?
Wow, that's a lot for Friday morning. Okay, look, we all know housing's become less affordable. We also know that labor and building materials means it's more expensive to build, right? And so we don't have enough housing units. Their price is going up and becoming unaffordable. How do we deal with this? And my argument is we can't build our way out of it. I mean, there's a few reasons. One, I go to Rhode Island every summer, right? You guys have great housing stock, right? But it's also the second oldest in the country, right? Outside of New York. And for those of us who are looking at 60, right? As human beings, we know that our body needs some help, right? As we age. Well, houses are the same, right? We want to preserve this housing stock. And we also need to preserve not just the structure, but the affordability, because we're seeing declining rates of home ownership. We're relying on this housing stock for older people to age in place, right? And they can't unless it's accessible, right? There's modifications and it's safe. So I guess what I'm saying is preserving our housing is incredibly important for the character of our communities, for the health of the people living there, for our neighborhoods. And you in Rhode Island don't have that much land to build new, right? And so we really have to focus on this. And when I talk about home repair, I am not talking about new granite countertops. I am not talking about additions. I'm talking about making sure that our homes are safe, watertight, warm, and that in fact those structures will remain, right? Because when a roof starts leaking and the owner doesn't have the money to fix it, right? That water that comes in, and Bert will talk about this, it's not just about the roof anymore. It's about the electrical system, it's about the walls, it's about the mold, it's about everything. So getting in there early makes a huge difference. And the one other thing I'm going to say, and I'm going to turn it over to my co-panelists, is that I have been pushing for housing preservation now since 2008, really hard. And when we talked back then, a lot of folks said, well, are they deserving? Are they a low-income senior with a disability? And as charity, we will help them fix up their home. And today, I don't hear that anymore. What I'm hearing from Republicans and Democrats and urban communities and rural communities is our housing is now over 60 years old. And if we don't give it an infusion of investment, we are going to lose these houses. And even if we save the structure, because in Rhode Island, 1 out of 4 homes that comes up to market is being bought by out-of-state residents. A huge number are being bought by investors. So you aren't going to lose that house, but that house is going to become a rental property and it's going to no longer be affordable. So as we're talking about home repair, let's just make sure we are talking about both maintaining the structure and maintaining the affordability of the home. I hope that answered some of your questions, Sally.
Yes, I know it was a big question to kick us off. And thank you so much, Karen. I think you talked about how this perception of home repair is changing over time, and also that we need to consider the whole home and preserving affordability, which I think is a really important piece that I know we'll continue to touch on. So now I'm going to switch to Bert. So Bert, GHHI's work focuses on this whole house model in various places. Could you talk about what this whole house model is? What does that mean? And what does it look like in some of the cities you've worked in?
Actually forgetting to take myself off of mute. I'm going to go ahead and start by I dropped a link into the chat there to our webpage, and I just wanted to cite a couple documents if folks are interested in downloading here. They're right on our website. We just posted these. There are 2 documents here. One is they're both around whole house plus electrification, which is a direction we've been moving recently. And one of them here is a resource guide that specifically goes into the electrification element of it. And another one here is an implementation training guide that will help you sort of get your head around whole house in a way that I'm not going to be able to do in just a couple of minutes on a webinar. So please feel free to access those documents. What I wanted to, I'm actually going to use a graphic out of one of those documents to explain the model a little bit, and then I'll talk about what this sort of looks like on the ground. There are a number, when we talk about whole house for us at GHHI, that means a sort of a specific model that we're advancing. And you can sort of see on the left side of the graphic there, I'm assuming you guys can actually see all this as well. Let me just make this bigger.
Are you sharing your screen? We can't see your screen, Bert.
Oh, you can, I'm sorry. I did share it, so maybe we've run into a technical issue here. It says it's sharing it.
It says it's sharing?
Yeah, hold on. Is that working? That's working.
There we go. Perfect.
Okay, sorry about that.
All
Yeah, so
good.
you'll be able to pull this right down from our website there. It's one of two documents there. And so the different program elements that we refer to are there listed on the left. I won't go through them all, but this can take the shape of a specific program, much like what we run in Baltimore, or you can get at these different elements through collaboration and partnership, which we're actually doing this quite a bit now in Providence, where we're looking to leverage each other's resources. But making sure that you've got alignment across different organizations or agencies doing the work. Braided funding is a huge part of our model, getting good at coordinating different funding streams and trying to come up with a single point of entry to the extent you can, or streamline client intake for folks coming into the program. I won't go through all of those, but you can do the reading there if you like, and pull the document down. We do all of this to basically execute scopes of work in three primary areas: structural repairs and retrofits, hazard remediation and efficiency, and increasingly electrification. And so we build these programs and partnerships to move forward scopes of work in low-income housing to get that work done. And the reason we do this is you can sort of see the benefits listed below there is we're looking to reduce healthcare costs. In Providence, for example, we are working specifically with pediatric asthma cases to go into their homes to remediate asthma triggers, frequently caused by moisture, cold, and a number of different issues, to reduce healthcare costs by improving the housing, improve quality of life for the folks who live there. We reduced operating costs for the home as we leverage in weatherization resources. And increasingly important in our minds is this notion of reducing greenhouse gas emissions. So those are some of the key benefits of the model. I wanted to just show you briefly, again, just sort of scrolling through the tool here, what this sort of looks like on the ground. And this is a case study that is one of the homes that we've worked on in Baltimore around what this can look like. And so this was an elderly woman who lived in Baltimore, had her daughter move back home due to illness, and the house needed a number of modifications to make it safe and energy efficient for them. And you can sort of see the types of issues we address here. Karen noted, moisture intrusion. We see that a lot in the housing we work in, and that can create mold and all sorts of other issues. Poor air sealing, natural gas stove not ventilated. We run across ventilation issues all the time, particularly bad for kids with asthma on down the line. But we'll go ahead and we will braid the resources necessary to get this work done. And in this particular example, the total cost came to about $60,000. And you can sort of see the types of issues that were addressed through the scope there around hazard reduction and remediation. We had to repair the roof on this one. Trip and fall injuries for seniors are something that we address when we go into homes, and other modifications. We weatherized the unit as well, and increasingly what we are doing now, and we're beginning to get evidence back around fuel switching and the cost of moving from natural gas to electric, but going ahead and trying to get folks where we can off the gas grid. So that's essentially what a unit looks like in Baltimore, and I can talk a little bit more about what we're doing here in Providence here momentarily.
Awesome. Thank you so much, Bert. Appreciate it. Thank you so much for giving that examples and kind of explaining how it's not just a one size fits all model either. It sounds like you're really approaching it's when it's whole house, thinking about that specific house and what that specific home needs as well, which is obviously not easy work. It takes a lot of working with the homeowner and working with the municipality or whatever incentives are available in that particular place. So I appreciate that.
Yeah, actually, just to comment, I skipped over one sort of key piece of this, which is this comprehensive notion of a comprehensive assessment. So you can go into a home and basically assess multiple issues, and we're beginning to do this now with Carrie here in Providence, where we're basically coming up with these comprehensive scopes and collaborating more as partners, and so it's an important part of that as well.
Awesome, thank you so much, Bert. So perfect segue into talking about Carrie's work. So Carrie, PRF has been focused on home repair for a while, but mainly in historic districts. Could you talk about why PRF decided to focus and kind of shift its approach to focusing on home repair programs for lower income homeowners, and how the partnership with Providence's code enforcement work and the state of Rhode Island kind of came about and what that looked like?
Sure. Thank you so much. It's really nice to see everybody here today. My organization is 45 years old, and it started really doing home repair, and we do a lot of other things now. But the home repair has always been sort of it was our first program, and it has continued to be one of our backbones. When the organization started, it was really focused on 3 historic districts that also were overlaid with redlining and systemic racism that came out of that, out of those types of programs, and really seeing that here was historic districts that clearly had more intricate and extensive repair requirements because they were in a local historic district that enforced Department of Interior standards, and also were undervalued in a way that meant that homeowners were not able to get loans from local lenders. So that was the work we did. And as things started to progress, it started becoming the historic districts, and then the blocks outside, and then the blocks got bigger and bigger. And when I came into the organization now about 6.5 years ago, I really started assessing what we were doing, and it became very clear to me that we had reached a point where we needed to be thinking about older properties, not necessarily historic districts. The districts themselves are not that big. We had done a lot of properties, and we continue to do so, but we really felt that our model really had a value outside of the historic districts. So we opened this up with our loan program. And our loan program is a low interest loan program that is really unique in that we have an in-house construction management team. That construction management team, a manager's assigned to every single project that we do. They will do they'll do a cost estimate. They'll do all types of, they'll bid the project out and then make sure it goes to through fruition. And we pay our contractors directly, so that way our homeowners are never stuck not being sure whether there's a change order that should happen or whether or not things are going the way they're supposed to. We take care of that, and that way they have a seamless program, and it creates a real success model for our borrowers. We initially started with the Department of Inspection and Standards because we had a homeowner who got in touch with us who was, I'd say, like a moderate income homeowner. They had some code violations, and because code enforcement put liens on the property, they had no manner of getting a loan from a traditional bank, nor did they have enough equity probably to get it anyway. What they were able to do was they came to us, and we said to ourselves, we feel comfortable with this because we pay the contractor directly. We believe we'll be able to cure the code issue, and therefore we're not taking a huge risk putting a loan on this property. But the one key thing was that I knew we needed to be able to have a really good open communication with Department of Inspection and Standards, because I needed to make sure that whatever work we did was going to ultimately mean that they were going to pull that lien. So we got in touch with the Department of Inspection and Standards, and that became a relationship where we just started working with them, where we would work with them on properties because we were willing to do it. And initially this started with people who had the ability to pay back a loan, but just could not find one elsewhere because either of equity issues, credit issues, or the code violation. What ultimately came out of it was that the department had amassed about $1 million in fines that were specified and protected by legislation to only be used to either address issues for the department itself or for homeowners who could not afford to fix their code violations and were in housing court already. Ultimately, we were able to bid and be and manage this fund for the city, which allowed us to be able to go in and work with cases that were being adjudicated and help them. That ultimately, the success of that program led us to expansion using ARPA funds for both the city of Providence and the state of Rhode Island. And over the last year, we have been managing a fund that is about $8 million. And I'm just going to say what's really unbelievable, or maybe everybody here will believe it, is that we are pretty much fully committed at this point with all of those funds. At this point, we will have done over 125 properties, which will amount to hundreds and hundreds of units. Many of these are multifamily properties. We've been able to not only do repairs, but at times, if there are units that are not being used because they are in such bad disrepair that they can't be rented out, we've been able to get those back online, put deed restrictions on them, create some affordable housing, and at the same time, help that homeowner to increase their own income by being able to rent those units out again. And not going to be the one solution to our affordable housing issues here in Rhode Island, but it is a new tool that we can really think about how we use. And for us, we also, we feel that people who are in these houses, they've often been in them for a long time. Many of them either have paid off their mortgage, or they got their mortgage a long time ago. They bought their house a long time ago. What they may be paying in housing costs on a monthly basis is affordable housing, even if there's no deed restriction on it. Because if they bought their house a long time ago, their monthly payment hasn't changed. And so they are actually in an affordable housing situation, and being able to keep them there is really important. And when we think about if they sold, because, okay, now they have equity if they've been there for a while, where are they going? Where are they going to go? And what rent are they going to rent? Because they're not going to be able to get back into the home ownership market. So what are they going to be paying monthly for rent if their mortgage payment is $1,000? So this is, these are sort of that policy issue to think about. What does it mean to be doing home repair, and how is that home repair actually also the preservation of affordable housing?
Thank you so much, Carrie. You touched on so many issues, including thinking about displacement and thinking about impact on folks, and that this program is already fully, the money's been committed, so people are really interested in this program. And so it shows that there's a real need there also.
Yes.
So learning about some other programs, Karen, can you talk about the home repair program that you worked on in Philadelphia? How did this program come to be? How did it evolve? How did it go to scale? Can you talk a little bit about that?
Sure. So this is a great day to talk to you from Philadelphia, because we're having our Super Bowl parade today. Thousands of people are streaming in now for a parade that won't start for 2 hours. It's going to be crazy, but I think we really needed a parade when we passed a $100 million bond for home repair. And we did it giving $60 million for grants for very low income homeowners, most under 50% of area median income, so very, very low incomes. And we gave the other 40,000 to a loan fund, because what we found in Philadelphia, and I would not be at all surprised if Providence had the same issue, is that 75% of low and moderate income homeowners who were applying for home improvement loans from banks were being denied. And it wasn't, Carrie said it could be because of credit or equity, but there was something else we found that was going on, which is the banks had the same administrative costs if you had a very small loan, $10,000 to fix a roof, as for a very big loan, which is $60,000 to put on an addition. So the person who needed $60,000 was getting the loan, and the one who wanted that small loan of $10,000. So the city actually got involved to provide those small loans, and there's been huge demand. How did we do it? So first of all, in Philadelphia, we were saying that the most affordable home is the home a family is living in right now. And we can save those homes. In Philadelphia, with a history of up to 60,000 vacant houses, knows that you invest in those houses or you lose those houses, right? As simple as that. But we also brought this broad and diverse group together, all of whom had self-interest in preserving the housing stock, right? So today, not only were we able with the $60 million in grants to get through a wait list that had 8,000 families on it and a 4-year wait. And unfortunately, some of those weren't living in their house anymore because the 4-year wait was too long. But we also had loans to give, but we also brought to the table lawyers. So the city pays lawyers to help untangle titles where the owner's name is not on the deed, so they don't qualify for home repair because their grandmother left it to them, right? And those records were never changed. Our hospitals and health systems are involved. Our children's hospital now will actually pay for bricks and mortar repairs in the houses of their patients who are repeatedly being coming to the emergency room or being inpatient for asthma or other conditions that impact the home. It is less expensive for a healthcare institution to fix the root causes in the home than it is to constantly treat that individual for those same symptoms. So we brought together kind of this broader ecosystem, and it worked so well that Pennsylvania started, this is coincidental in name to what Bert was talking about, but the Whole Homes Repair Program. And the idea was Pennsylvania put out millions of dollars for every community in Pennsylvania, and the uptake was astronomical. Right? The money was gone and only 4% of people were helped, but it helped them and it worked. And so now one of the senators from Pennsylvania is pushing to make that federal legislation. And so our hope is that there'll be more resources for these kinds of repairs in the future.
Awesome. Thank you so much, Karen, for showing how this program went from a city program to a state program and now potentially a federal program, and also the different approaches to grants versus loans. And I really appreciate all you touched on, and very exciting day to be in Philadelphia. And I love the idea that needed a parade for when they got the $100 million bond. So now I want to transition, bringing it back here to Providence. Bert, you are based here in Providence, and GHHI is expanding its work here, including with Providence Revolving Fund. So could you talk more about what your work looks like here and how you're collaborating with other groups doing home repair work?
Sure. Yeah, we're very excited and grateful to be implementing a $2 million HUD Healthy Homes Production Grant Program here as we look to build our services. And as we're standing up the program there's sort of two tracks that we're advancing. The first one is asthma specific. So as Karen noted, it makes a lot of sense for us to fix the homes of asthmatic, particularly pediatric cases, with kids there, so that their homes aren't making them sick. And so we've got partnerships with a number of clinical providers, and we're enrolling families, and we'll go in, we'll assess the home. We provide comprehensive asthma education alongside the work we do on the unit, and we will follow up with that family for a year to sort of measure their outcomes and monitor improvement. And so we're super excited about that, and that work continues to move forward, and we're receiving referrals. If any of you are working in the Providence area and you know a young family where the kids are suffering with asthma, please send them our way, and we'll get in there and provide those services for them. As part of that effort, well, actually, I'll come back to the partners in a minute. The second track that we are working to advance is with our local CAP agency, which provides weatherization services here in the city. And so we see this as a sort of a fundamental equity issue, where you've got a housing stock where approximately, I believe the number in Providence is around half of the units that go into the low-income weatherization programs end up getting deferred for moisture issues or asbestos or whatever it might be. And they're not able to take advantage of those weatherization services. So knob and tube wiring is actually a big issue here in Providence, as Carrie I see her nodding over there. Carrie will tell you. And so we're going in and we've got some resources that we're working to resolve those issues, refer back into the weatherization program so they can go ahead and finish the weatherization work, and we can help that family save money and reduce greenhouse gas emissions and all that other good stuff. So those are sort of the two tracks that we're working to advance. I want to note on both those tracks, both those populations, the weatherization, we're actually working with a lot of seniors now as well, which is which is nice for us. But we are coming across code violations. We see the need for major structural home repairs, and this is where we're excited about the partnership with Carrie, because we're referring units over to her now, where she's able to sort of take on these major structural issues, so that allow us to go back into the unit and basically do the health and safety interventions that, if there's a leaking roof, wouldn't be effective. And so I would say we're sort of organically building that collaboration. We do have a grant where we were hoping to go in and do this sort of whole house approach with Carrie, with One Neighborhood Builders. It's a $20 million community change grant into the EPA. I don't know that it's ever going to get read given what's going on in Washington at this point, but we were hoping to do whole house plus electrification in 100 units here in the city, and hopefully that will someday we'll figure out a way to fund that or find additional resources to do this work. But that's sort of how we're moving forward in some of the key partners in the work there.
Thank you so much. So looking at time, we're going to transition to some of the questions that folks submitted in advance for this discussion. So in addition, if you have other questions, feel free to put them in the chat and we can talk about those too, and or raise your hand. The raise your hand function is if you go to React and then click on React, there should be a raised hand. And so I'm going to go to a question submitted by Gigi. And this is for anyone to answer, any of the panelists. So what policies currently exist in Rhode Island? I'm sure we could expand this also to other places to hold landlords accountable for maintaining safe and habitable housing that does not contribute to asthma triggers? And what financial or legal incentives exist to encourage landlords to proactively improve rental housing conditions rather than wait for tenant complaints? So some really good questions in there. If anyone wants to take that, feel free.
Carrie, I would defer to Carrie on the policy side of the work there. Oh, you're muted, Carrie.
I mean, I think that when we think about what it means to be repairing homes and how we think about all of these issues of making sure that we're dealing with all of these major problems, is that we're looking at how the money ultimately is being spent. And obviously when, I'm just looking at this question again and like sort of to encourage landlords, and here's the part. First and foremost, I want to just say our programs always, when I was asked, were these only for occupied properties? No. If a landlord wants to take the time to repair their homes, we want them to. I don't, I've had sometimes people who have called and asked us about home repair programs who I know are notoriously bad landlords in terms of the conditions of their home. If they're going to let us go in with our construction managers and do work, we're going to go do it. Does that mean that the value of their property is likely going to increase? Sure. But at the same time, we also know that we're going to get inside and we're going to be making sure that we're addressing all of the issues. Now, our programs often, we get called in because someone will say that, we need to deal with we need a new roof or we need painting. Our process is we go in and we do an inspection. We can't unsee what we see. So if we walk into a house and there's lead paint issues that we can visually see, we need to address those. If we see that there are conditions where there are rodents, where there might be no issues with the plumbing, things like that, we're going to address those. And that's part, in some ways, of the relationship we have with code enforcement is that we're also not we're going to say, look, we're going to go ahead and we'll make sure that we can try to figure out how we repair these. But if you walk away, there is going to be a code violation placed on that property. We are not going to unsee what we saw. We think that's really key and really important. And so we'll go in. This is also where we start working with Bert with lead paint, programs, and really make sure that we are, that we're layering resources, because we've had properties that we've gone into where we've had to do upwards of $120,000 worth of repairs because of the rental units. And for us, it's important, but obviously that exceeds our limitations on this program, but we can pull in funding from other sources so that we can layer it and make sure we get the work done.
Carrie graciously accepted my punt on the question there. Thank you for that, Carrie. Yeah. I was typing in the text when it was asked, but I didn't listen to the question. Sorry. I think the area where we've seen some policy work on this front has really mostly been around lead recently. And so in the last 2 years, we've seen the legislature require landlords to obtain lead safe certification, to file those certificates in a statewide registry, which we finally seem to be getting up and going. And they also, as part of that, a whole host of bills, allowed tenants to pursue treble damages in the event that there was an issue with the unit that resulted in a problem. So we've seen on that front some pretty significant advancement over the last couple of years, and I think there's interest in that registry and sort of using that as a way to advance additional sort of policy initiatives as we start more closely tracking the rental stock in the state. So I think that's probably where we've seen the most action lately on the policy front.
Yeah, I have to, but I feel I have to just make one little pitch here about the registry though, which is there are some significant problems that the state is having. And so I do want to just say, please understand, people also need to understand that even the very best and most attentive landlords are having a really hard time getting an inspector because we don't have enough at all, like not even close. And so this is there, it is also creating another issue. So just, I think we need to also make sure that as we're approaching it as practitioners, that we're doing so understanding all of the issues. And I would ask everybody, like, if anyone asks you about it, like really push, why don't we have more inspectors? To me, that's the question. Why don't we have more inspectors? It's a good job, pays well. Seems to me would be great to get people trained up and get them to be lead inspectors. All right, that's a little outside of what we were talking about, but I felt I had to.
Yes, thank you so much, Carrie and Bert. And I did see some other, in terms of the question on financial incentives, Kate Felder from Rhode Island Energy mentioned that Rhode Island Energy has some incentives right now for homeowners that's owner occupied and not owner occupied, including in Providence, there's $10,000 per unit available for weatherization. And so that's another incentive available right now. And yes, so that's exciting. And so check out Rhode Island Energy's website or contact Kate for more information. And also the lead programs in Providence as well were also mentioned. Sam mentioned the joint lead replacement programs it's a free program. So look into those as well. So seeing that it's great that we have folks, it's, I think, just showing how many people are working on this as well. And so Karen, I want to ask you this question in the chat that from Brenda. Can you talk about how you coordinate home repair with modifications to help people age in place? What have you seen around this?
So if there's anything that I want you to get out of this conversation from me, it's that home repair has just very, very broad and important impacts in life, right? I do a lot of research. We know it allows people to age in place safely. We know that it reduces falls that could be life-changing, right? You've all heard of that broken hip. We know that it increases school performance because a child has a safe place to do their homework. We have 2 studies now that show it reduces crime because it invests in a neighborhood, right? And so these small programs, it may seem mundane to take a hammer, put a ladder against a building and fix it, but huge impacts. And the one for aging in place is incredibly important because we are finding in a lot of communities. I just did 3 focus groups with homeowners in Richmond, Virginia. We're looking at whether home repair actually helps Black wealth generation and preservation. And they all said, look, if I lose this house, I have no place that's affordable to go, right? So it's not that I am aging in place because I have chosen my home over assisted living or something else. This is it. This is my option. And that housing may involve 1 bathroom on the 2nd floor, right? It may involve a whole bunch of things that they need to do it. So the programs that are really, really successful do exactly what Bert's diagram showed early on, which is they work together, they braid funding, they deal with what the house needs and what the occupants need, and they try to fill it all in, right? Because if in fact the house is warm, safe, and dry, and an older person is in there, well, that house met their needs 20 years ago, but it doesn't meet their needs now because they can't access those stairs, right? They can't do it. So they have to be done in concert. And I think that really is important because home repair programs, every community has one. They're almost all funded by federal funds and they're tiny programs. And this premise was we don't have much money, so let's give Miss Thelma $10,000 worth of this. And then let's give this one $5,000 with this. And in fact, what we're doing is we aren't meeting the need. And so I have definitely seen the amount per home, the depth of the repairs go up. And it's not just costs that are going up, but that's happening too. So closer to $25,000 in a house rather than $5,000. And then once you make those modifications, it helps not only that occupants, but the ones who come after, right? Our homeowners in this country are older, right? In a lot of cities like Providence, right? 75% of seniors over 62 own their own home. And so we have to transition that housing for them and keep it in good repair to keep their health up. It's a huge priority.
And I see.
Yeah, if I
Oh, yeah,
could
go
jump
for it.
in
Go
also
for it.
on that, just to say, I mean, we've found that with these programs over the last 18 months that our average repair cost for a property is about $43,000. And that sort of equates to about 30 something per unit. And that's, when we start talking about that, people look at it, it's a huge investment, but it is really important when you think about where do people go if this doesn't get repaired, and what's the investment there, right? What happens if they end up selling, if it's an older person, they go into some sort of an assisted living, they're going to be out of that asset really quickly, whatever they were able to sell their house for. And they're not even getting the full real value of their property without the repairs. And so it's leaving them in this situation where they are losing their one real investment. And we know that this is how homeownership has really historically created a middle class. And without being able to pass intergenerational wealth, that is getting lost, and it is going to continue to really create a larger wealth gap. And that's the part that, these programs actually, believe it or not, they're not that, I mean, they're cost effective. They're really, when we think about saving units, if you build a new unit of affordable housing, and Grace and Allie, because you guys are doing it, we're talking upwards of $450,000 per unit. here we're saving a unit for 30. And again, as I said, this is not going to be enough, but it sure means that we don't want to be losing the units we have.
Thank you all so much. And I see Bert put some resources in the chat to the question about preserving for aging in place on some work that GHHI is doing with Blue Cross Blue Shield in North Carolina. And we'll be sure to share out all the links that were shared in the chat after the session. So as we're at 9:30 a.m., I want to thank our panelists for their time, insight, and expertise this morning. As we heard, these are big issues, and so surely we're not able to fully comprehensively cover it in 45 minutes, but I hope this piqued your interest and gave you some things to look into further. And I also want to thank all of you who took time out of your Friday morning this Valentine's Day to join us. We hope you'll consider joining us at a future Fresh Friday.